Hi, my name is Selena and I'm from Pain-Free Physiotherapy and Aligned Health. Do you have problems scratching your back? Do you find it hard to grab a book from the top shelf? Do you have a shoulder pain when you try to lift? If yes, this is the video for you. Today, I'm going to talk to you about rotator cuff tendinopathy. Our rotator cuff includes four main muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. They all wrap around the scapula, which is our shoulder blade here, and comes down and attached to our head of humerus, which is our arm bone over here. These tendons can be injured and causes pain in our shoulder, known as rotator cuff tendinopathy. To understand how muscle imbalance causes rotator cuff tendinopathy, let me tell you how the muscles normally work first. This is the scapula, our shoulder blade. This is the humerus, our arm bone, and this is a muscle called deltoid. Due to its attachment, it can produce forces with force vectors pointing up and to the front. Whereas at the same time, in normal situation, the rotator cuff muscles, indicated here in blue, should be also working counteractively to produce a downward and backward force to stabilize the shoulder. If one muscle out of the two get tight, the imbalance in muscle forces will be causing a faulty position of the head of the humerus. This type of shoulder muscle disruption will always cause three problems. 1. Instability, 2. Impingement, and 3. Tendinopathy. Depends on the patient and the type of the muscle imbalance. They could present with one symptom more than the other. If the patient's presentation relates more to the tendon, then we'll call it a tendinopathy. Rotator cuff tendinopathy can be acute or chronic. People with this condition usually present with symptoms such as shoulder pain, decrease in range of motion in all directions, and night pain with compression on the affected side. Your doctor may get you to get some sort of imaging such as ultrasound or MRI, and in most cases, these imaging will show a thickening of the tendon. They will assume you have inflammation due to the thickening of the tendon, therefore prescribe you with anti-inflammatory or pain medications without treating your real cause. In fact, there is a very poor correlation between imaging findings and the pain. In other words, there is a high chance that imaging does not show your real cause. At Pain-Free, we use a holistic approach to assess your body as a whole to identify and treat all your symptoms rather than just focus on your symptomatic area. In your case, your shoulder. We'll perform a head-to-toe examination to find out all the possible primary contributing factors. In most cases, we find that the primary contributing factors is actually not from the shoulder, but in somewhere else. It can be on your neck, your upper back, on the muscle in front of the shoulder, the deltoid, or even down onto the calf. You may ask, how does that work? Alright, let me give you an example. So if I have a very stiff upper back, it's very hard for me to lift my arms up, as you can see. If I force myself to lift it up, I'll actually injure my shoulder instead. So in this case, the cause of my shoulder pain is actually not in the shoulder, it's in my upper back. Therefore, treatment-wise, we'll find all the tight structures that you have and try to loosen them in order to restore your normal biomechanics. We'll give you a home exercise program depends on where the cause is. If we find that the cause is your stiff upper back, we'll give you exercises to loosen that up.
Okay. So now, can I get you to lie down for me? Okay. So we're going to have the foam roller positioned right on top of the shoulder blade to start with. Okay. And then I'll get you to bend your knees for me. Okay. And then I'll get you to push down through your feet and then elevate your bottom. Good. And then in this position, we're just going to try to rock your body forward and backward, like that. Okay? Sometimes you may hear a few sounds around your back. That's a good sign that you are losing some really stiff segments. So when you're doing this exercise, for people with a very stiff upper back, it is going to be very painful for you. So I would recommend either you choose a softer foam roller, or instead just use a pillow, okay? Or any cushion to start with. So now, this is a way to regress the exercise, okay? So we're going to again position the pillow right underneath the shoulder blade, and in this position, see how you feel first. If you're already feeling some stretch, it's a good position for you really. But if you don't feel the stretch, you can simply bring your arms up, just next to your ears. Yeah. So this should further increase that pulling sensation around the upper back. So when you're doing this exercise, there shouldn't be too much of the pain. Some pulling sensation or slight discomfort is okay, but just make sure the pain is not unbearable. Okay?
So, if you suspect you have rotator cuff tendinopathy, feel free to talk to us and we'll be happy to answer your questions and tell you what we can do to help.